Hi, everyone, and welcome to SCN8A Unraveled. I'm Sarah Tay with the International SCN8A Alliance, and today I'll be interviewing Jennifer Andrews, a researcher at the University of Arizona. So, Jennifer, would you like to introduce yourself?
Sure. Hi, I'm Jennifer Andrews, and I work in the Department of Pediatrics, College of Medicine, Tucson. I am a clinical researcher, and I usually focus on rare disease. My specialty is trying to determine phenotypes within a disease category. And I also really try to focus my science and approach towards helping people live better lives, even though they have a chronic illness. And part of that is when studying rare diseases, we use registries a lot because there's not as much information out there for rare disease. Fewer people study it. And a way to getting better informed treatments, better informed approaches to managed care involves getting data from individuals living with a rare disease and getting their lived experience to help us understand.
Yeah, absolutely. Well, we're so happy to have you here today to talk to us more about registries, specifically the SCN8A registry. So, can you tell us more about that? Why
Yes.
registries are important and about the SCN8A registry?
Yeah, so there's registries are important for a lot of reasons, but in rare disease, it's really critical because a registry collects information about an individual that's not necessarily a specific focus. It's about how they're being treated, what is happening as they age, what kinds of symptoms they experience when, what medications work and don't work. It's a very patient-focused approach to research, and it provides a number of benefits in that you can communicate and connect directly with individuals with rare disease if there are new studies or there's new information that we want to share. We can provide data on patient-reported outcomes, like how many people are experiencing the same things that my child is experiencing. And then it helps us understand what happens over time because lots of changes happen in the body from birth through puberty and beyond. And being able to understand how we can treat people because we know what is happening to them as they age is really important. A lot of registries will use similar tools that surveys use, but it's very different from a survey because a survey is specific to one question. You have a research question, and that data can only be used towards that research question. And it can include scales, so it might be able to assess your risk for depression or risk for developmental delay or something along those lines, but it's restricted to just that. Whereas in a registry, you can ask more global questions because we're collecting data from the perspective of what is happening. Then somebody can ask a question, okay, what does it look like for SCN8A when a child is going through puberty? How are the different treatments doing for people with different phenotypes within SCN8A? Can I answer a different question with these data? Yes, you can. You can answer a question from multiple perspectives because the data that we're collecting is objective in essence. And it's things that the parents are reporting, things that are in the medical record or things that are clinically related, but they're not specific to any research question that we had to begin with, but rather we're trying to paint a picture of what people look like with SCN8A across the lifespan, across the world. And then for the SCN8A registry in particular, there is minimal information typically in an neurology record on growth and development and minor changes in developmental milestones. And so these kinds of things really need to come from the parents. And as we know, or as you all know, SCN8A looks very different from child to child, and there are some individuals who can meet developmental milestones and some who won't meet a developmental milestone, but that doesn't mean they don't have incremental change over time that we want to see and document. Because to parents, somebody being able to lift up their head even a little bit, even if it's not to the 45 degrees that's required for the developmental milestone, it still makes a difference in their quality of life. And so this registry is really hoping to create a data set that has information that's relevant to families and researchers, as well as individuals planning clinical trials, so that we can give a resource back to being able to answer all of the questions that are still unanswered in SCN8A. And then part of that is making sure that it is an international registry. It was established in 2015, and at the time of the manuscript that we'll be talking about, it had been through 3 rounds, and we had 253 respondents, one of which is an adult with SCN8A, but the majority are parents responding for their children. There are now 12 modules and participants from 6 continents. Currently, we have translations in English, Chinese, Portuguese, and Spanish. And there is a new module planned for people with a loss of function variant, which, as you know, is a different phenotype presentation with more social and emotional and developmental delays and fewer of the physical issues that are experienced by people with a gain of function mutation. And then this is just an example of what the languages look like within the modules. And participants can go up to the top and click on what their language is, or their language preferences. And then all of the questions, as well as the responses, are translated so that they can read and understand what is being asked and provide relevant information. And then the last thing is that this registry is always changing and growing. So we're the Alliance and Dr. Hammer's lab are really trying to make sure it's as inclusive as possible. The next translation is going to be Japanese, and they are interested in providing as many languages as needed to make sure that there's global participation. There are plans in progress for creating an API, which is a tool that lets data be linked between platforms. And then that way, in the family portal, they can present information that comes from the data in aggregate, or they are hoping to maybe even put together a platform that says, here's how your child looks, and here's how they look compared to everybody else in the registry. And then the last thing that's happening right now, which is really exciting, is that the registry data is being used by clinician experts to help design and develop a set of guidelines for how to detect, diagnose, manage, and treat individuals with SCN8A, taking into account the different levels of severity that are occurring. Oh, sorry. And then I did have some pictures for you. This is the current set of individuals who are actively working on the registry and the registry data to get more information out there. And so it's a pretty diverse group of people with different interests, asking questions from a variety of different perspectives.
It's so nice to see everyone's smiling faces. I feel like a lot of the time we hop on these calls and it's like, here are all my slides on my research, but it's nice to see all the faces behind, all the great work that's going on with the registry. As you mentioned, there's so much data and information that's going into it. Like, it makes sense that it takes a village to figure out, what does this mean, and, transform that into information that's relevant for clinicians and families.
Yeah.
So I guess you talked a little bit about your manuscript. So can we dig into that a little more? Like, what is in there?
Yeah, so it is a methods paper, which is basically describing how we went about collecting this information and what kind of information is in the registry. So it's more of a bird's eye view of what type of information is in there and available. And part of the reason for this is to make sure that people are aware that this resource is available. and how to get in touch with us to collaborate. So I'll go over like each of the tables and figures that are in there and try to explain in a little more detail why it's in there and how to use it. So this first table is participant characteristics. You'll notice in most research papers that you're looking at, there's always a table 1. And the table 1 is really just a picture of who participated in the study, or in this case, who is in the registry, and kind of what they look like. Do they differ? And does it look like it's appropriate for whatever the condition is under study? And so in this one, you'll see that we separated it out by who did and did not have seizures. That's one of the more global ways of separating out people with different levels of severity. And you'll notice that, the majority of individuals within our data set do experience seizures. And then the corresponding information is that they are much more likely to have intellectual disability or delay than people without seizures. And they're also, unfortunately, more likely to have been diagnosed with an alternate seizure disorder before getting their SCN8A diagnosis. And that's important because if you're diagnosed with something else, there might be treatment guidelines for that, and that may or may not be appropriate for SCN8A. And so that's what this table kind of looks like. It's just an overview. And for the majority of what we're looking at in this paper, it's a global view of everybody that's in the data set. Because there are so many different ways to look at grouping individuals with SCN8A, whether or not it's what their mutation location or their mutation type, or what symptoms they're experiencing, there's a variety of different phenotypes that you'll see in SCN8A. We don't look at that in this paper, but we show all the data that allows you to be able to do those kinds of cuts and slices and separations of different subgroups within the SCN8A population. And then, as I said, it is global. It's heavily based in the US currently because that's where it originated. However, we are slowly but surely adding people from different countries. And as we expand the languages, then we will be able to expand participation more globally, I guess, across the globe. Okay, and then this figure was talking about what the seizures looked like for our participants and their children, both at the very first onset and what they experienced across their life, because sometimes it changes. And more than half experienced generalized tonic-clonic seizures, and then about 40% experienced focal seizures at some point in their life. And then 12% of our population have never had a seizure. And then we also look at medications. We collect information about medications over time. So what have you taken, when did you stop taking it, and why? And a little brief intro to what kind of information can be accessed from the database. 68% of all of the population with seizures used levetiracetam at some point in their life, but more than half of those people stopped taking it. And 30% say that it's one of the worst medications that they've ever taken and don't use it. But there's still 7% of the population that say it's one of the best medications. So you can't just completely rule it out. What we need to do is figure out why that 7% differs from the other people who think it's a horrible medication, so that we can say, okay, if you look like this picture clinically, levetiracetam might work for you, so let's try it. But for the rest of you, we're not going to try it because it's going to make it worse. And then overall, about 31% are using oxcarbazepine ongoing. So that's a popular medication for our participants. And then the last thing I wanted to show you is this graph and how to read it. So basically, on the left-hand side here, you'll see the percent of our population in the registry who have achieved a motor milestone. I'm sorry, a developmental milestone. And that includes fine motor, gross motor, personal skills, language skills. And as you can see, early on, many individuals start out meeting their milestones prior to the age of like 4 months. And so, we start out with people, about 80% of our population doing okay. And then they start either losing skills or not gaining subsequent skills in subsequent ages. And as you can see, over time, our population falls further and further below the curve with regards to their ability to develop properly, or develop and achieve the same types of things that somebody without this condition might achieve. And that limits what and how they can do when they get older in life. And so we really want to find out if there's a way to either reverse this or give them even a subset of skills to improve their quality of life. Maybe an individual who's very severely affected will never, be able to have good gross motor function. But if we can give it to them so that they can move their arm a little bit or move their head a little bit, that might be a major milestone for them, even if it doesn't mark as being meeting a general milestone for children. So those kinds of things are available in the data set. And then just to kind of explain, as a scientist, we have very few metrics to say that we're doing a good job and not getting fired. And one of those metrics is writing manuscripts. But it's not just putting manuscripts out there for the sake of putting manuscripts out there. Part of the way the system works is we can't say anything that we can't show with the data, right? And so we're very restricted in what we're allowed to say the data show or what the data are doing. And so because of that, people tend to be able to use our data because we're not making claims that can't be justified by what's already in the paper. And so we put it out there as evidence. And most of the time you'll see that we don't say a lot of things like prove or treat or definitely. We're just kind of saying it looks like this is what's happening and here's why. But then other people can then take all of that information that's been published and put it together to use for to guide them. So for clinical trials, you can use all of this information across all of these manuscripts or from this registry to put together a historical control. So we can say, this is what everybody looked like before we put this treatment in, and now we can recruit a subset of individuals with SCN8A and try this treatment. And that gives us the ability to not have to force a subset of individuals participating in a clinical trial to get a placebo, especially if the medication works really well. You don't want to prevent them from having that and prolong the amount of time that they have, unregulated seizures or worsening of symptoms. The other thing that is really important is that you use any manuscript information in this registry to provide real world information. So family foundations can use what we find to help guide other families in how to get a diagnosis and manage and treat their child with SCN8A. And they can use this information to demonstrate, okay, you have this phenotype, you should talk to this set of families because the data that we have shows that you're best suited to follow this path. Oh, and then I did mention before, but the one really exciting thing that is happening right now, and I want to reiterate that, is that there is a group of experts who are using this data and some of the manuscripts that we have to try to set forth guidelines to help people have a systematic way of being treated so that you're not experimenting with drugs that may be harmful to you or may not work at all. Because there's nothing worse than going on 7 different medications to try to find the one that works for you. And any other kinds of treatments. So they're doing a more global thing. It's not just medications. but they're helping, they're using this data to help them make decisions as to what to do when and why. And that can also be subsetted into, you do this only if the clinical picture looks like X. And that's it. Again, you know, the registry group is really, really interested in answering as many questions as possible about SCN8A. So anybody who's a researcher that's interested in collaborating on SCN8A research should definitely contact Dr. Hammer. The data are not restricted to just our group. We want to have as many people using this information to answer questions for these families as much as possible.
Yeah, well, thank you so much for your time, Jennifer. This has been really informative, and it's really nice to see how all the registry data is being used and kind of what's going on your end. So many of our families have spent a long time filling out the registry, and again, it's just really nice to see the
Yeah.
in action.
I think, you know, in closing, the two things I would like to say is thank you. First of all, I know it takes a lot of time, but the second thing is I'd like families to know how important these data are, because SCN8A is a relatively new and rare disease. And the more people that participate in this registry, the better. If we have 1,000 participants, then we can even create these tiny little slivers of populations where only 7% of people with SCN8A experience these things. If we have a bigger population, then we can answer those questions. But if we only have a few participants, there's not as many questions that you can ask because numbers matter.
Yeah, absolutely. It's one of those points about representation,
Yep.
and getting as
Get your
many
voice in
people.
there. Yeah.
Exactly, exactly. Um, so thank you again. And I guess to the rest of you, thank you for joining us for this episode of SCN8A Unraveled, where we unravel the science of SCN8A.